Before going further with our video, first I would like to talk about some of the basic information or facts about the coronavirus or COVID-19. So what do you know about this disease? What is COVID-19? Where it came from? Or is it dangerous? So let's start with what is it? This disease is named Coronavirus Disease 2019 or COVID-19. It is an infectious disease caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. This disease also has other names such as coronavirus, COVID, or novel coronavirus pneumonia. So, where this disease came from or what happened? This disease was first identified in December 2019 in Wuhan, the capital of China's Hubei province. It has since spread globally, resulting in the ongoing 2019 to 2020 coronavirus pandemic. As of 3 May 2020, more than 3.44 million cases have been reported across the 187 countries and territories. This resulting in more than 243,000 deaths, but more than 1.9 million people have recovered from this disease. Next, let's talk about this disease history or story. The virus is first thought to be natural and has an animal origin through spillover infection. The actual origin is actually unknown, but the first known cases of infection happened in China. Some of the earliest cases of this disease had a link to a wholesale food market in Wuhan. Many of the initial patients were either stall owners, market employees, or regular visitors to this market. Some environmental samples was taken from this market in December 2019 and tested it was positive for SARS-CoV-2 or COVID-19. The market in Wuhan City was suggested to be the source of this outbreak or play a role in the initial amplification of the outbreak. Then it was closed on the 1st January of 2020. After that, COVID-19 was identified in early January and its genetic sequence was shared publicly on 11 or 12 January. It shows that COVID-19 has an ecological origin in bat population and was not a manipulated or constructed virus. In December 2019, the spread of infection was almost entirely driven by human-to-human transmission. Then human-to-human transmission was confirmed by the WHO, which is the World Health Organization, and Chinese authorities by 20 January 2020. Now, we can move on to the next topic.
How is COVID-19 spread? So that is the question. Let me explain on how it can be spread. The coronavirus known as COVID-19 can be spread from person to person in close proximity, similar to other respiratory illness such as flu. Firstly, it can be spread through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can come into direct contact with other people within 6 feet or can infect those who pick them up by touching infected surfaces and their face. According to scientists, cough and sneeze can travel several feet and stay suspended in the air for up to 10 minutes. Transmission is of particular concern on transports, where droplets containing the virus could pass between passengers or via surfaces like airplane seats and armrests. There is evidence that the COVID-19 virus can last on surfaces, especially plastic or metal, up to 3 days. Now, I would like to explain the symptoms that the victim might get from COVID-19. The severity of COVID-19 symptoms can range from very mild to severe. Some people may have only a few symptoms and some people may not have any symptoms at all. People who are older or who have existing chronic medical conditions like heart disease, lung disease, diabetes, severe obesity, chronic kidney or liver disease, or who have compromised immune system may be at higher risk of serious illness are the group that have high risk to get COVID-19. The most common symptoms of COVID-19 including having fever, cough, and tiredness. Other such symptoms including difficulty of breathing, muscle ache, sore throat, loss of taste or smell, headache, and chest pain. If the patient did not get any medical treatment, it can lead to death.
Next, how to prevent the spreadness of COVID-19. We can prevent the spreadness of COVID-19 by using COVID-19 hierarchy of controls, which consists elimination, substitution, engineering controls, administrative controls, PPE, and community protective equipment. So firstly, elimination is completely eliminating exposure to the hazard, the most effective control. Second, substitution is replacing the hazard with a non-hazardous object, device, or substance. Third, engineering controls is isolating the person from the hazard through physical or mechanical means. Fourth, administrative control is changes made to the way that people work. Fifth, personal protective equipment, equipment worn by the person to protect themselves from real or potential hazard. Example, gloves. Lastly, community protective equipment is equipment worn by a person to prevent community spread from an asymptomatic carrier of COVID-19. Firstly, elimination. We can stay home, avoid public areas, or work remotely. Second, we can have virtual meetings, site visits, and training through the use of web conferencing applications such as Zoom and Skype, and having video calls by using WhatsApp or FaceTime. Second, substitution. This is still unidentified because scientists still cannot find the cure for this disease. Third, engineering controls. Firstly, we can use handles, push buttons, and other high touch points made of copper or coated with copper tape. SARS-CoV-2 has a low virus stability on copper surface, and research has proven there to be no viable virus after 4 hours on copper surface. Second, barriers, partitions, or ropes to separate employees from public or building occupants. Example, plexiglass screens. Third, drive-through style partitions and windows. Fourth, for the administrative control, we need to have a social distancing procedure, which is to stay 6 feet away from other people. Next, Malaysian government has ordered to do a movement control order first, and then after movement control order, they give conditional movement control order. Lastly, we need to have health monitoring. For personal protective equipment, COVID-19 related PPE requirement currently exists for patient care, person under investigation transport, isolation room entry, and COVID-19 research. Respiratory protection, N95 respirators and KN95 respirators are critical supplies that must be reserved for healthcare workers, first responders, and those performing hybrid tasks in direct support of the continuity of healthcare, public safety, or essential research. Lastly is community protective equipment. Community need to wear masks and use hand sanitizer to prevent the spreadness of this COVID-19.
Effects of COVID-19. Number 1. On economy, COVID-19 has caused the collapse of Malaysia's economy. How this happened? Lockdown in many countries has been measured to contain the spread of COVID-19. This made unusual shock in global oil demand. As the result of this unusual shock, the oil production increase has led the price of oil to drop significantly. Furthermore, the pandemic also affected the tourism sector. Number 2. On environment. Due to this virus pandemic, many countries having drop in air pollution. How this happened? Because of the lockdown, many sectors of economics has been stopped temporarily to contain the spread of COVID-19. This has affected in reducing air pollution because of less factory and car operate during the lockdown. And lastly, on people's social life. This pandemic as a result change in education and also our communication way. How this happened? Due to coronavirus outbreak, education system has changed to online method where students will using their technology to access their study. Also, all religious activities, major sporting events and social events such as music festival and concert has been cancelled due to control this pandemic.